Alright guys, back to talk about another med today, and this time I checked, the sound is on now. So, for those of you in the future, the first time I did this, I did it without the sound, so guess what? Had to redo it, so that's what we're going to redo it, but that's alright because we're going to talk about Diazepam, or as is better known as Valium. And again, it's a really great drug for stopping seizures, but we got a lot of other uses for it. And so that's what we're going to talk about today. Yeah, everybody gets diazepam. Oh yeah, knock them out, let them have it. That is 100 thing. Now, of course, we don't usually say hand me the diazepam. We usually say hand me the Valium. When we give it rectally, it's usually in a gel form, and that's the Diastat. So again, diazepam is your pronunciation. And for those of you that need to memorize this by tomorrow, there you go. Merry Christmas. But that's the chemical structure. It is a benzodiazepine. Okay, it's in the class of tranquilizers, and it's used to manage a lot of things, anxiety disorders, to help with alcohol withdrawals, muscle pains. It helps for when you have a black widow spider bite. The stuff is great for stopping those spasms. So again, but you got a sedation for conscious sedation is what we can also use it for. So again, it suppresses the action of seizure activity, and it raises the seizure threshold, which is actually why when your Versed's not working, I actually switched to this one, because it actually, I think, works a little bit better. It kind of depends on what type of seizure and what's going on. Again, it is a muscle relaxant. They have an amnesic effect, so when you give it, they're not going to exactly remember exactly what happened. Sometimes that's a good thing, all right? Again, in diazepam, again, makes your day just wonderful. Its onset is usually immediate for IV push. If it's rectal Valium, it's about 1 to 5 minutes for it to engage. So once you push it, again, make sure that you get it past the sphincter, gets into the rectum, it gets absorbed. It's about a 5-minute absorption. Again, it lasts for 15 minutes to an hour, depending on how much you give, how big the patient is, what's going on. So it's a drug of choice for seizures or status epilepticus. Status is, again, they keep having seizure after seizure after seizure after seizure. Okay, sedation prior to a cardioversion is actually very good for that. Again, your sedation prior to RSI, it does work just as well as a Versed, actually. The reason sometimes we don't like it is because again, given too quickly, it does cause a little bit of blood pressure problems. And again, it's agitation due to alcohol withdrawal. If they're having delirium tremens, it's good for that. Again, so short-term relief of anxiety, they will prescribe this PO at the house. Again, cocaine intoxication. It relaxes the blood vessels, which they're having coronary spasms. This is actually the drug to go to. And you got severe muscle spasms due to back strain. It works really good for those. Now, as a barbiturate and a tranquilizing class drug, it's going to cause a lot of CNS problems. Thus, the entire list there. Yes, it's going to make everything slow down a little bit. All right. And usually, by the way, the reason that they have a bradycardia from this is because it kills the respiratory drive. And so again, but hypotension. And it is very irritating to the vessel, so make sure that you give it slow and with a lot of volume as far as, diluted a little bit. Again, it can cause respiratory depression or respiratory arrest, so that's one of the big ones. And it does increase interocular pressure. So again, if you got something that's causing interocular pressure, glaucoma, penetrating eye injuries, again, usually that, if it's something that's going to cause that increase in ocular pressure, you might want to stay away from it. Again, if they have a head injury, if they got respiratory depression, you probably shouldn't be giving this drug. If they're in shock, stay away from it. Again, if they've got any type of general nervous system depression, again, glaucoma, hypotension, substance abuse, again, that's a relative contraindication for it. It still can be given, but it's going to cause some problems. Just remember, if you give it with an antihistamine, let's say, I don't know, Benadryl, we talked about the go to sleep cocktail, again, and if you mix it with Benadryl, yeah, it's going to work even better. Tricyclic antidepressants, alcohol, all of these things can increase the effect of it, potentiates the effect. And if it's diluted, it can precipitate. It's in a more oily based. So if you're going to mix this up, probably a sterile water is the better choice there and not your normal saline. Again, make sure that your respiratory equipment's on hand just in case something bad happens. And matter of fact, one of the things that you'll find out is if you're a status epilepticus patient, you finally give them enough to stop the seizure, and then they start not breathing. So again, the effects of Cimetidine, ETOH, other CNS depressants, that's your Tagamet, by the way, it potentiates the effects of those. Again, using caution with elderly patients, again, if they've got liver problems or if they're a kid, it's completely unpredictable. Sometimes it works great, sometimes the receptor sites aren't there and you got problems. As a matter of fact, the younger the kid, probably the less I'd lean towards this. And again, remember that Diastat is your rectal administration of that. It's more of a gel-type substance. It's made for rectal use. And then, again, respiratory depression. Your reversal agent for that is Romazicon, which we no longer carry most of the time in EMS. The problem is we would give them Narcan and we give them Romazicon, and then they'd have a seizure, and then we would have no way to break them out of it. Excuse me. All right, sorry about the sneeze, guys. All right, so preps. Again, there are pill forms of it. They do give them at home. 20 milligram in a 2 ml ampule, 10 milligram in a 2 ml ampule. Most of the ones that I see is the 10 milligrams and 2 mLs. That's kind of your common one in the EMS setting. So 5 milligram and 10 milligram suppository, that's your Diastat doses. So we give, and it says 2 to 20 here. A normal dose to start with is 2 to 5. 2 to 5 slow, but 2 to 20 is the range that you might see. Your maximum dose should be 30 milligrams total. If you've gone to 30 milligrams and you're not getting a response, you need to start looking at another reason, something else to do. Your kids, pediatric dose, 0.1 to 0.2 milligrams per kilogram. And then, again, I wouldn't go over 20 milligrams in a kid, even though sometimes it takes more Valium because, remember, the little kids don't have the GABA receptors in which to do that. Again, make sure you flush it real good with with the rectal. Make sure that you push it in there, make sure that it goes in. And the Diastat cartridges that they have today, actually, you don't need to follow it with saline. Your IVIO rectal suppository, remember, there are PO versions of it. We just don't give it in the EMS. And I will tell you that it does cross the placental barrier and causes problems with the human fetus. So make sure to ask that they are pregnant because we don't want to give Valium in that case. All right, that's it for Valium, and we will see you on the next one.